on health care reform, and he's making sure the president knows it. Listen.
Mr. President, it's time to scrap this bill. Let's start over in a bipartisan way.
House Minority Leader John Boehner is a Republican from Ohio. Congressman, welcome to you, sir.
Trace, good to be with you.
You know, we talk a lot about these CBO numbers, and I want to get your take on the meeting today between President Obama and Doug Elmendorf, the head of the CBO. A lot of people are saying, wait a minute here, Mr. Elmendorf is risking his credibility by meeting with the president. We looked back. This meeting is almost unprecedented.
It really is somewhat unprecedented, and I don't blame the CBO director, Mr. Elmendorf, because after all, it was an invitation from the President of the United States. But I do wonder why the President invited him to the White House. He has a big job. He's the nonpartisan director of the Congressional Budget Office, charged with providing fair analysis of what legislation would cost and what impact it would have.
And those numbers have greatly impacted Congress, the debate here. Those numbers have impacted the debate, and the president says those numbers are not accurate. They're not figuring in a lot of things. It would look awfully strange if tomorrow or the day after the CBO came out and said, well, you know what? We redid the numbers, and the president's right. We left a few things out.
Well, we'll see. But it's pretty clear that the number one issue when it comes to health care in America is that people are concerned that they have to pay too much for our health care. And they're right. And there's nothing in this Democrat proposal that does anything to reduce the cost. On the contrary, this bill is going to cost about $1.6 billion more in taxes and fees in order to enact. And at a time when we're trying to save money in health care, I don't know how spending $1.6 trillion over the next 10 years is going to lead to lower costs.
And the polls are going down. I mean, the public opinion polls now, favorability of this plan have dropped significantly in the past couple of weeks. I want to get your reaction to what the Speaker of the House said. She was asked, and she went on the record, she was asked, can you sell this to a country as the right plan without Republican support? Her answer is, well, we would certainly like to have bipartisan support, but understand that we have differences of opinion as to the role of government as it relates to health care. If there are ways that Republicans want to participate, that's fine. So she's saying, you know, if y'all want to jump in on this, that's fine, but we don't really need you.
Well, that's been pretty clear to me for some time, because not at one level have Republicans have been asked or invited to be involved. Not at one level, not at the committee level, not at the leadership level. As a matter of fact, we've been purposefully excluded from the process. And I think at the end of the day, the American people realize we've got to do something on health care. And both parties understand that we're trying to get to affordable access to health insurance for all Americans. But I think most Americans also realize that the only way we're going to get there is to work together in a bipartisan way on their behalf. That hasn't happened. The bill that's before us will ration care, will drive down quality, and put the government in charge and put the government in the middle between doctors and their patients. And this isn't what the American people want.
Congressman, we keep hearing that this plan, we're going to save $360 billion from Medicare. And nobody has brought up the point that Medicare is drastically underfunded as it is right now. You have liabilities you cannot meet. How can you save $360 billion from a program that's in debt?
Well, not only $360 billion are they going to cut out of Medicare, which means reimbursements to doctors and hospitals in our communities. There's another $300 billion in cuts that will happen to Medicaid, and that's health care for the poor and for those who are in nursing homes. These are unprecedented cuts that if Republicans would have ever put on the table, they'd have hung us for even suggesting these kind of cuts. The American people are not going to accept this.
Congressman, the clock is ticking. Thank you, sir. We appreciate your time.